Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an optometrist talking to a patient called Mr. Lucas. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, Mr. Lucas. Your GP referred you to me after you mentioned having issues with your vision, particularly at a distance. Can you tell me more about what you've been experiencing?
Yeah, so I've been having trouble seeing things clearly when they're far away. It's been going on for a while now, maybe about 6 months. I first noticed it when I was driving. The road signs would just blur out, and I'd have to squint to make out the letters. I thought it might just be tiredness, but it's getting worse, especially in the evenings.
I see. So it sounds like you've been struggling with distance vision for quite some time. Has it been affecting other areas of your life as well?
Definitely. At work, it's become a bit of an issue. I work in an office, and although my computer is fine because it's close, during meetings, if there's something projected on the screen, I can't read it clearly unless I sit in the front. Watching TV is also harder now unless I'm sitting closer than I used to.
Okay, so it's more than just occasional trouble, and it's starting to impact your daily routine. Have you had any vision problems before this, or is this the first time you've noticed anything?
No, I've never had any issues with my eyes before. I mean, I always had perfect vision, at least that's what I thought. I guess I've taken it for granted because this has been a bit frustrating.
I understand that. Nearsightedness, or myopia, can develop gradually, and often people don't notice it until it starts interfering with daily activities like driving or work. From what you've described, it sounds like you may have developed mild to moderate myopia. Have you had any headaches or eye strain, especially after trying to focus on distant objects for a while?
Yeah, actually, now that you mention it, I've had quite a few headaches. They tend to come on later in the day, especially after I've been driving or if I've been in a meeting where I had to strain to see something far away. My eyes feel tired a lot too, like I've been using them too much or something.
That's pretty common with myopia. The headaches and eye strain come from the effort your eyes are making to focus on distant objects. It's like they're working overtime to adjust. Do you find yourself squinting a lot?
Oh, constantly. It feels like it helps, but I guess it doesn't really do much. I've tried just ignoring it or adjusting things, but it's hard to function properly when everything far away looks blurry.
Squinting can temporarily help because it changes the shape of your eye slightly, allowing more focused light to hit the retina, but it's not a long-term solution. So let's talk about solutions. Have you considered glasses or contact lenses?
I've thought about it, but I've never worn glasses before. I guess I've been a bit reluctant. I don't really like the idea of having to wear something on my face all the time, and contacts seem like they'd be a hassle.
That's a very common concern. Glasses today come in many lightweight, stylish options that don't feel heavy or uncomfortable. They're also easy to adjust to. As for contacts, many people find them convenient once they get used to them. It really depends on your personal preference and lifestyle. We can discuss both options further and see which feels right for you.
I guess I'd be open to glasses, but contacts still seem intimidating. What would you recommend, though? Is there a specific type that would suit my situation better?
For mild to moderate myopia like yours, glasses are typically the first and most straightforward option. You can wear them when you need them, like for driving, watching TV, or in meetings. There's no pressure to wear them all the time unless you want to. As for contacts, they offer more flexibility for those who prefer not to wear glasses full-time, and they've come a long way in terms of comfort. You can try daily disposables, which are single-use and very low maintenance.
That doesn't sound too bad. I think I'd like to start with glasses and maybe try contacts later once I get used to it all. I just want something that will make daily life easier again.
That's a great plan. We'll do a full eye exam today to determine the exact prescription you'll need. Based on your description, it sounds like a mild prescription should help you see things clearly again without strain. Once you start wearing the glasses, you'll notice the difference immediately, especially with tasks like driving or reading things from a distance.
I hope so. It's been frustrating, especially when I'm driving. I've had to ask passengers to read signs for me a few times, which is embarrassing.
You'll feel a lot more confident behind the wheel once you have the correct lenses. If glasses don't feel like the right fit later on, we can always explore contact lenses or other options like LASIK surgery, but
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mrs. Perry. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Welcome, Mrs. Perry. How are you today?
hi, doctor. Well, not great, to be honest. I've been dealing with some things that are starting to really worry me.
I'm sorry to hear that. Can you tell me what's been going on?
It's hard to describe, but over the past few months I've noticed that my skin has been tightening, especially on my hands. It's not just dryness or anything like that. It feels like my skin is pulling, making it harder to move my fingers. I also have these red spots, and sometimes my fingers go numb when I'm cold. I'm not sure if they're related, but it's been happening more often.
I see. Tightening of the skin and changes in sensation, particularly in response to the cold, can sometimes indicate an underlying condition. How long have you been noticing these symptoms?
The skin thing started maybe 6 months ago, but the numbness has been on and off for about a year now. At first it wasn't a big deal, just a little discomfort, but lately it's gotten worse. It feels like my skin is becoming too tight for my hands, and it's affecting how I do everyday things. Even holding a cup of tea can be tricky.
That does sound concerning. Have you noticed any changes in other parts of your body, or is it mainly your hands?
Mostly my hands, but I've noticed my face feels a little tight too, especially around my mouth. It's strange, and sometimes it feels like I can't fully stretch my lips. I haven't thought too much about it until recently because it's subtle, but now it seems like it's spreading.
And what about any other symptoms? Pain in your joints, heartburn, or perhaps difficulty swallowing?
Funny you mention that. I've had more heartburn lately, but I didn't think it was connected. I've also felt like food gets stuck sometimes when I swallow, especially if I'm eating something like bread. It's been happening more in the past couple of months. And yes, my joints are stiff, mostly in the mornings. I just figured it was part of getting older, but now I'm not so sure.
It's good that you've come in to talk about this. The symptoms you're describing, skin tightening, numbness, joint stiffness, and difficulty swallowing, can be linked to a condition known as scleroderma. It's a rare autoimmune disease that affects the connective tissue in your body, which can lead to the hardening and tightening of the skin. It can also impact other internal organs, including the esophagus, which may explain the heartburn and swallowing issues you've been having.
Scleroderma? I've never heard of it before. Is it serious?
It can be, but it affects everyone differently. Some people have only mild symptoms that don't get worse over time, while others may experience more significant issues depending on which parts of the body are affected. The good news is that there are treatments that can help manage the symptoms, though there's no cure for the condition itself. The key is early intervention and monitoring to prevent complications. It can be, but
That's a bit of a relief, but also a little scary. What causes it?
Scleroderma is an autoimmune condition, meaning your immune system mistakenly attacks your body's own tissues. In this case, it targets the connective tissues, causing excess collagen to build up. Collagen is the protein that helps keep skin firm, but when there's too much, it leads to that tight feeling you're experiencing. Unfortunately, we don't fully understand why it happens, though genetics and environmental factors may play a role.
I see. Is there anything I could have done to prevent this?
No, there's nothing you've done to cause this. Autoimmune diseases often come on without a clear trigger. What's important now is to focus on managing the symptoms and preventing any further complications. It sounds like the skin and joints are affecting you the most right now. Are you able to manage your daily activities, or is this starting to impact your quality of life?
It's definitely making things harder. I have to take longer to get ready in the morning because my fingers don't move as easily. And when I'm in the cold, my fingers go numb quickly. I've even noticed a few ulcers on my fingertips that seem to take forever to heal. I love gardening, but lately I've had to cut back because of the pain and the tightness in my hands.
That must be frustrating. The cold sensitivity and ulcers you mentioned are likely related to something called Raynaud's phenomenon, which is common in people with scleroderma. It causes the blood vessels in your fingers and toes to constrict in response to cold or stress, which is why your fingers turn numb or change color. There are medications that can help improve blood flow and reduce the frequency of those episodes.
That would be helpful. I'm always worried about my fingers now whenever I go outside. It's not like before.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor explaining about antibiotics. Now read the question.
Now, the good news is that we can treat this with a simple course of antibiotics, so that's what I'll be recommending for now. The antibiotic I'm suggesting is called nitrofurantoin. I'll write that down for you because it's generally well tolerated and it's the #1 choice for treating a urinary tract infection. I hope you don't mind this bit of scrappy paper here. This is 1 tablet, twice a day, for 5 days. For most people, it works well. However, in about 1 in 100 cases, it can cause a bit of nausea, so if you find that you're feeling nauseous, it could be the medication and we might need to switch to something else. We'll come back and talk about that if necessary.
That's okay, that's fine.
Now look at question 26. You hear a medical tech specialist talking to a colleague about the advancements in surgical robots. Now read the question.
The world, and by 2030, the market for these robots is projected to reach around $16 billion. What's really exciting is that these robots are starting to integrate with AI platforms, making surgical decisions more precise and efficient. Think about it, a robot surgeon that operates with the accuracy of a PhD in precision. The potential for improved outcomes is enormous.
Now look at question 27. You hear 2 nurses discussing an article in a nursing journal. Now read the question.
Did you read that article about using telehealth and virtual nursing for stroke patients in the latest nursing journal?
Yes, I found it really promising how virtual interventions could help reduce the workload for inpatient nurses.
Absolutely. But I think many nurses could have predicted that. Virtual nursing has been slowly gaining traction for years.
True, but having solid evidence is essential to push for widespread implementation in hospitals. The study suggests that telehealth could improve patient care and satisfaction, so it's worth pursuing.
I agree. Plus, with many stroke survivors needing long-term care, virtual nursing can make follow-up care more feasible. The article definitely makes a strong case for expanding its use.
Yes, especially since the initial results show it's effective and well received by patients. I just wish they'd included more data on how telehealth impacts stroke rehabilitation outcomes specifically.
Well, there's a link to the full study, so you could dive into those details if you're interested.
Now look at question 28. You hear a medical professional explaining improper disposal of biohazardous materials. Now read the question. Over the past few days, we've noticed an increased concern regarding improper disposal of medical waste and biohazardous materials. This is an issue we need to address immediately, so we'll be reviewing our waste disposal and biohazard handling procedures. I understand that some of you have already received training on this topic, but it's critical to ensure that everyone is up to date and following the correct procedures. First, you should be familiar with the proper segregation of medical waste. This includes separating general waste from hazardous materials and ensuring that sharps are disposed of in puncture-proof containers. Please check the designated bins and sharps containers regularly and replace them when they are full. Secondly, you must always wear the appropriate personal protective equipment, such as gloves, masks, or gowns, when handling biohazardous waste to prevent contamination. After disposing of the waste, ensure that the containers are properly sealed and labeled as biohazardous. Lastly, remember that all waste management practices must comply with environmental and safety regulations. We must follow disposal protocols strictly to avoid any contamination risks. Any questions before we proceed? Now look at question 29. You overhear a conversation between a patient's family member and a nurse regarding end-of-life care. Now read the question.
I can understand how difficult this must be for you. Have you had a chance to speak with the hospice care coordinator?
Yes, but I'm really struggling with this. The doctor told me that hospice is the best option now, but I don't want him to suffer or feel abandoned. I'm not sure if this is the right decision for him. I see him getting weaker every day, and it's breaking my heart.
Have you talked to your father about what he wants during this time? It's important that we consider what will make him feel the most comfortable.
Now look at question 30. You hear a public health specialist giving a presentation about a study he has conducted. Now read the question.
I'm here to discuss a study on improving health literacy and patient education for diverse populations. We focused on patients from various cultural backgrounds who have limited health literacy. Our intervention involved using simplified medical language, visual aids, and culturally tailored materials to explain complex health information. We worked with a group of 60 patients over 6 months. By the end of the study, 85% of the participants showed significant improvement in understanding their treatment plans and following medication instructions. This outcome led to better management of chronic conditions and reduced hospital readmissions. One key insight from this study is that health literacy interventions can have a tremendous impact on patient outcomes, particularly in underserved communities. This research supports expanding similar programs in primary care settings, especially for patients who face language or literacy barriers.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sarah Martinez, expert on genetic testing. You now have 90 seconds to read questions.
Hello and welcome to Health Research Roundup. Today, we're talking about the rapidly expanding field of genetic testing and how it's revolutionizing personalized medicine. Genetic testing is helping doctors tailor treatments to individual patients based on their unique genetic makeup. Joining us today is Dr. Sarah Martinez from Stanford University Medical Center, who has been at the forefront of this research. Dr. Martinez, thank you for being here.
Thank you for having me.
Let's start by asking a basic question. Why is genetic testing so important for personalized medicine?
Well, genetic testing is important because it allows doctors to understand a patient's genetic profile and use that information to predict how they'll respond to certain treatments. For example, some people metabolize medications differently, so what works for one patient might not work for another. By analyzing a person's DNA, we can identify these differences and select the treatment that is most likely to be effective for them, which can significantly improve patient outcomes.
So instead of a one-size-fits-all approach, you're saying this allows for more individualized treatment plans?
Exactly. In traditional medicine, treatments are often developed based on averages, what works for most people. But as we know, everyone is different. Personalized medicine through genetic testing helps us move away from that model and provides treatments that are specific to the individual. We're seeing this applied more and more, especially in fields like oncology, where certain cancer therapies are now being matched to the genetic mutations present in a patient's tumor.
That's fascinating. How long has genetic testing been used in this way? Is it a relatively new development in medicine?
In a way, yes. Genetic testing has been around for decades, but it's only in recent years that we've had the technology and the understanding of genetics to apply it effectively in personalized medicine. Initially, it was mostly used for diagnosing rare genetic disorders. Now, with advances in genome sequencing and a better understanding of the human genome, We're able to use genetic information to guide treatment decisions for more common conditions, like cancer, heart disease, and even mental health disorders.
That brings up an interesting point. How is genetic testing impacting the treatment of diseases like cancer?
It's having a huge impact. One of the most significant breakthroughs is in the field of oncology. For example, certain types of breast cancer, like those with the BRCA1 or BRCA2 mutations, respond better to specific therapies. We can use genetic testing to determine whether a patient has these mutations, and then prescribe the treatment that's most likely to work. The same is true for other cancers, like lung or colon cancer, where specific gene mutations influence how well patients will respond to targeted therapies.
Are there any downsides to using genetic testing in healthcare, though? It sounds like a perfect solution, but I imagine there are some challenges.
You're absolutely right. There are definitely challenges. One of the biggest issues is cost. Genetic testing can be expensive, and not all healthcare systems or insurance providers are willing to cover it, especially if it's not deemed absolutely necessary. Another issue is privacy. People are understandably concerned about how their genetic information will be used, and who will have access to it. There are also ethical concerns about what people do with the information once they have it. For example, if a genetic test reveals that someone has a high risk of developing a particular disease, what does that mean for their insurance coverage or employment opportunities?
That's an important issue. Are there regulations in place to protect patients' genetic information?
Yes, in many countries there are laws that protect the privacy of genetic information. In the United States, for example, the Genetic Information Non-Discrimination Act, GINA, prevents health insurers and employers from discriminating based on genetic information. But even with these protections, there's still a lot of debate about how genetic data should be handled, especially as testing becomes more widespread.
It sounds like there's a lot to consider. Beyond cancer treatment, are there other areas of medicine where genetic testing is making a big difference?
Yes, we're seeing it used in a number of areas. Cardiovascular medicine is one example. There are certain genetic variants that can increase a person's risk of heart disease or stroke. And we can use that information to tailor prevention and treatment plans. It's also being used in psychiatry, where we're beginning to understand that certain genetic markers can predict how patients will respond to medications for depression or anxiety. The potential applications are really broad, and we're only scratching the surface.
That's amazing. Given how promising this field is, do you think genetic testing will become a routine part of healthcare in the near future?
I think it's inevitable. As the technology becomes more affordable and accessible, and as we continue to understand more about how our genes influence our health, genetic testing will likely become a routine part of healthcare. We'll be able to screen for a wide range of conditions and make more informed treatment decisions. It's really exciting to think about where this could lead in the next decade.
Exciting indeed. Before we wrap up, is there anything else you think people should know about genetic testing and personalized medicine?
I would just say that while genetic testing is a powerful tool, it's not a silver bullet. It's one piece of the puzzle in understanding a person's health. Lifestyle factors, environmental influences, and other elements still play a significant role. But genetic testing gives us an incredible window into what makes each of us unique and allows us to take a more personalized approach to treatment.
Extract 2. Questions 37 to 42. You hear Dr. Adam Reynolds talking about self-diagnosis using online health information. Now, read the questions. You now have 90 seconds to read questions.
I'm Dr. Adam Reynolds, a general practitioner. And today I'd like to talk about something that's becoming increasingly common but also increasingly problematic: self-diagnosis using online health information. It's no surprise that people turn to the internet when they feel unwell. With so much health information readily available online, it's tempting to type a few symptoms into a search engine and come up with a diagnosis yourself. However, this trend is leading to significant risks, both in terms of misdiagnosis and inappropriate treatment choices. Now, I'm not saying that accessing health information online is entirely a bad thing. In fact, reliable websites and patient information portals can be valuable educational tools when used appropriately. The issue arises when patients try to diagnose and treat themselves without proper medical guidance. Many symptoms are nonspecific and can be linked to various conditions, some of which are minor, but others can be life-threatening. Unfortunately, online platforms often provide general advice that fails to take into account individual patient histories or the nuances of symptom presentation. Take, for example, a patient I recently treated. We'll call her Lucy. Lucy was in her late 22nd and had been experiencing persistent headaches and fatigue for about a month. Instead of seeing a doctor, she decided to search for her symptoms online. Based on what she read, Lucy believed she was suffering from chronic migraines. She followed advice she found on an internet forum and started taking over-the-counter painkillers every day. Not only did this fail to address her underlying issue, but it also led to medication overuse headaches, a condition that worsened her overall health. When Lucy eventually came to see me, it was clear that her symptoms were actually due to an underlying thyroid issue, which had gone undiagnosed because she delayed seeking professional care. Had she consulted a healthcare provider earlier, the problem could have been detected and managed much sooner, sparing her the additional complications she experienced. This case is just one of many I've seen in recent years where patients have relied on incomplete or misleading online health information, with potentially serious consequences. Another problem with self-diagnosing online is the tendency for people to jump to worst-case scenarios. The internet is full of anecdotal stories and unverified medical advice, which can be misleading and fuel anxiety. For instance, people might experience mild chest pain and immediately assume they're having a heart attack based on what they've read online, when in reality the pain might be due to something far less severe, such as acid reflux. The issue here isn't just unnecessary worry, but also that focusing on the wrong diagnosis can delay appropriate care for the actual condition. On the other hand, some people may downplay serious symptoms because they've read accounts online of people with similar symptoms who turned out to have minor ailments. This can result in life-threatening conditions going undiagnosed or untreated. The internet doesn't have the ability to differentiate between symptoms that may look alike but stem from very different causes. This is why it's crucial for people to consult a healthcare provider who can assess their full medical history, conduct physical exams, and, if necessary, order diagnostic tests to reach a precise diagnosis. I've also seen cases where people misuse health apps or symptom checkers. These apps can be helpful tools for gathering information, but they are not substitutes for professional medical evaluations. The algorithms used in these apps are based on probabilities and cannot account for the complexities of individual cases. It's common for people to receive several possible diagnoses through these tools, leaving them confused and unsure of how to proceed. To illustrate the dangers of relying solely on online information, let me share another case. A man in his 42nd, let's call him John, had been feeling shortness of breath for a couple of weeks. After consulting an online symptom checker, he convinced himself that it was due to anxiety. He followed some breathing exercises he found online, but ignored the advice to see a doctor. When John finally came to my clinic, his condition had worsened, and after running some tests, we discovered he had early-stage heart failure. By delaying proper treatment, John had put himself at greater risk. Had he come in sooner, we could have managed his condition more effectively before it progressed. The moral of the story here is that while online resources can sometimes provide helpful general information, they should never replace a visit to a healthcare professional. Doctors are trained to consider the whole picture, which includes not just your symptoms, but also your medical history, lifestyle, and any risk factors you might have. Self-diagnosing can lead to inappropriate treatments, delay in necessary care, or even the worsening of an existing condition. So, my advice to anyone feeling unwell or uncertain about their symptoms is simple. Don't rely on the internet for diagnosis. Instead, consult a healthcare professional who can provide accurate advice, a proper diagnosis, and a treatment plan tailored to your specific needs. Let the internet be a tool for learning, not diagnosing.
That is the end of Part C. You now have 2 minutes to check your answers.